Hello, everyone. Thanks for calling in today. We're going to go ahead and get started. To start, I would like to ask everyone to help us build a complete participant list by entering your full name in the attendee list, which is on the center right of the webinar window. If you need to edit your name in the attendee list, click the drop-down menu in the top right corner of that box and choose Edit Information. Then you can enter your first and last name. If you are part of a group listening in on a speakerphone, please enter your organization name in the attendee list, and then use the chat box in the bottom right corner to enter the first and last names of everyone who is gathered with you. Thank you for making sure your name is complete and correct. This information is important for our record keeping. As a reminder, we've muted everyone's lines to prevent feedback and background noise during the webinar. We are recording this webinar, so keeping the phone lines muted during the presentation makes a big difference in the quality of that recording. Welcome to the CRA Series Part 2, Native Connections, Identifying Your Issue webinar. My name is Kim Blessing, and I will be your moderator today. At the end of today's presentation, we will have a Q&A session, and you will have the opportunity to ask questions either over the phone or using the chat feature. You'll be able to unmute your phone line during the Q&A session by pressing *6. We do ask that you hold all your questions until the Q&A at the end of the presentation. If you need technical assistance during the webinar, please call 509-319-1070. I will also remind everyone about the Q&A instructions once we get to that point. Our presenter today is Deborah Rattler, Native Connections Director, and I will now turn it over to Deborah.
Good morning. This is Deborah Rattler. I'm Grovant, and I'm your Native Connections Director. And we'll go ahead and get started here with our second webinar. We have some upcoming webinars. On January 7th, we'll have our third Native Connections webinar, which will be defining the community. And then after that, the next one is January 14th, conducting key respondent interviews. January 28th, demonstrating the scoring process. Again, our webinar host will be Kim Blessing, who is our moderator, and myself, Deborah Rattler, and Connie O'Mara, our Native Connections Coordinator.
Hi, everybody. I'm Connie O'Mara. I'm a member of the Citizen Potawatomi Nation, and I'm going to take you through a little icebreaker that kind of shows the connection between our personal readiness and how we get our communities ready to address a goal or overcome an obstacle. And so what I'd like to have you do is in the chat box, please share a life goal you achieved just recently or in the past, and what are 2 or 3 steps you did to reach the goal? What did you do to help yourself get ready to reach the goal? And we'll give everybody a chance to enter. I think we have some staff that might be willing to enter an example for you, and this will just kind of get us started in a good way. Give folks just a few seconds to do that. It looks like a lot of people are typing. So maybe it might be bungee jumping or riding a horse or something like that you achieved and what you had to do to get ready for that. And Kim, if you see some responses, please feel free to share those.
Looks like we have multiple people typing. Oh, we have some coming through. Great. Master's degree in organizational leadership.
Big goal. Also remember to type in the 2 or 3 steps that you took to get ready for that. I see ask a spiritual cultural leader to write a letter of support. That's a perfect example. Thank you. And here's a really good one. I have to agree. Being a parent, life goal to be a parent. Pray, pray, pray. That's so true. Thank you, Candace. Maybe we have time for one more here. I see someone shared the mindfulness step, focusing on the mindfulness and breathing to get ready for a goal. So I really want to thank you all for sharing those, and feel free to continue to share those. We're going to go ahead and move on. But we just wanted to show that connection between you getting yourself ready for something in your life and how you're going to help your community get ready. So the goals for our webinar today are, the Native Connections goals are to prevent and reduce suicidal behavior and substance abuse. These are the overall goals, and also the goals of our webinar to help you get your community ready for all of this. To reduce the impact of substance abuse, mental illness, and trauma. You know, and our public health approach teaches us to reduce risk factors and increase our protective factors like culture. And also to allow American Indian and Alaska Native communities to support youth and young adults as they transition into adulthood. So here's a little map of the Native Connections Cohort 1, and you can see where you are on that map and where your buddy is also on that map. And that just kind of gives us a quick bird's eye view of where everyone is. So our learning objectives today, and remember, we're here to guide you through the process of community readiness. It's not something that you'll learn overnight. It's a process. It'll be a process for several years in your community. But what we're going to try to do today is review the purpose, dimensions, and stages of this model. We're going to explain the process for how to use it, and we're going to give you some step-by-step guidance for doing this assessment in your community. So go ahead and turn it over to Deborah.
Okay, for the community readiness model, our purpose is to ensure success. And we're going to be doing that by providing a process that will find the stage of readiness for your community, where you're at. And then from those stages of readiness, we're going to look at creating specific strategies or plans, programs, something that's going to produce really good results, without costing a lot of money. And on this slide here, we put up the Native Connections Community Readiness process, and this shows all three of the processes that we're going to be going through. And if you look in the center, you're going to see where your community name is, your tribe, your program. And then if you start over to the right on the inner circle where it says community efforts, and then just proceed around clockwise around the inner circle, you'll see that we're going to be going through the community knowledge of effort, our leadership, community climate, community knowledge about the issue, resources related to the issue. And I'll talk a little bit more about each of these in a few minutes as we progress through this. But if you look at the next circle, you're going to see the 9 stages of readiness. And again, this starts on the right side and it proceeds clockwise. And you're going to see the 9 stages of readiness that I think we're all going to be going through some of these stages and, progressing. And you can see how they're related. And again, you'll go through some of them, maybe back and then forward. And then the outer circle is going to be the process that we're going to be changing. So when we look at the 6 dimensions of readiness, we're starting with our community efforts. And this is looking at something that's already been done in your community, whether it's a suicide prevention program, some kind of plans. Maybe you have some groups that have been meeting about trying to do something for prevention efforts. Awareness. Do people know about what's happening in suicide prevention? What is the community's level of knowledge about what's happening? And then leadership. Formal, informal? Are they encouraging to these efforts? Are they supportive? How are your community leaders supporting these changes? Community climate is looking at our attitudes, understanding, people asking, what can I do? How can I do something in suicide prevention? Awareness of suicide issues, questions, understandings, knowledge of these issues in our communities. And then we look at the people, our knowledge, our traditions, places, that are going to be supporting our efforts here. So we have our first polling question here. We're going to be pulling up our box here in a minute. And so on a scale from 1 to 10, how concerned are our elected leaders with providing suicide prevention mental health services for community members? So take a minute here to, and we'll see what results we come up with on here. Well, it looks like on our results here, we're getting anywhere from 4 all the way up to 10. And it looks like pretty much kind of in the middle, number 5, about 38% of you are saying that, there is support from your elected leaders. Okay, Connie?
Okay, so thanks, Deborah. We're going to go over the 9 stages of readiness now, and you'll think, for your Native Connections project, where is my community? Where am I starting off with my community in terms of addressing issues, suicide prevention, getting youth more involved, and all that comes out of the information from your interview questions. So the first stage is no awareness. Community really doesn't have too much awareness about that suicide or something that's going on in the community that you're trying to address. Or 2, denial resistance. There's the knowledge about it, but they're just not ready to deal with it. And 3, vague awareness. They're starting to understand it a little bit more, but still not too sure exactly what to do or where to go with that. Moving on to the 4th stage of readiness is pre-planning. You're seeing your community start meeting. You're seeing people start talking more about things. It's easier to be more open about that. Stage 5, preparation, you see some active planning going on in the community. There are more people involved. And 6, initiation. People really have engaged with this issue. We have more people working on the issue. And there's, that real potential to make a difference. Moving on to stage 7, stabilization. The community is seeing the results of working together. Things are starting to calm down. The issue isn't as, we're not in crisis as much. We've made a difference with that issue. 8 is confirmation and expansion. People are just really taking ownership, beginning stages of taking ownership, and now expanding some of those wonderful activities and strategies that they're using to reduce suicide or other issues in the community. And, of course, 9 is what we all want to strive for and where you will get someday over time. If you continue to use this model, I think it'll really help, and that's the high level of community ownership. So we're going to look at an example of an overall score by dimension and stage for a community. And for some of you, this is something familiar. You've seen it before. For others of you, it may look a little busy, but basically by the time you're done with the readiness assessment that you've done in your community, it all makes sense. So you can see those dimensions, dimension A through F, all the different dimensions that Deborah talked about, kind of like the community efforts, what they know about the efforts, the leadership. D is the prevailing attitudes about That's the climate in the community. E is community knowledge about the issue, and then F is resources. So you can see where people are falling on a readiness level of 1 through 9, from the initiation all the way to full ownership. So that just gives you a little peek at how that works. Don't let it overwhelm you. We're going to guide you through that process. And I believe Deborah's doing the next slide.
Okay. So we're going to look at the process here a little bit, Ruby. And again, the issue is suicide prevention. This is what we're all working towards in Native Connections. And then, each of our communities, we have our villages, our towns, the ages of our populations, the gender makeup. You were looking at all of the different ways that, make up our communities. Our interviews, we're going to be conducting interviews, and this will be about from 6 to 8 people. And then if you're thinking about, who am I going to be interviewing, who's appropriate, we're going to be guiding you through. It could be Indian Health Service, behavioral health, mental health, our education, whether it's elementary, post-education, law enforcement. There's several different levels of law enforcement, tribal courts, and social services. And then the one that I had down here also was our spiritual, whether it's traditions, churches, or however your community finds that. So as we proceed through this process, we're going to be developing some plans, methods. These are going to be goal-oriented. And again, we're focusing on suicide prevention. So this is also going to look different, for everybody. And it's going to be tied back into your readiness levels. And then again, we want to make a difference, a positive difference. And that's what we're striving for, is that community change. And so we put the wheel back up here again because we want to make sure that, you can have a visual of how this all interconnects, and the graph that Connie went over earlier, you can start seeing in that graph, and then this one, it's just how it's all interconnected and how we're going to be moving through this. And we have a polling question. Is local data on suicide prevention available in our community? And if so, from where?
So if you could type your answer into the chat box in the lower right, please. So again, is local data on suicide prevention available in your community? If so, from where? And I see some answers coming in.
So when you're looking at, your data, we've got one from Claudette. She says yes, from Aberdeen. Oh, it looks like we have quite a few coming in here. Domestic abuse programs, tribal courts, schools, clinic. So it looks like you've been accessing or you're seeking out those, the data that's going to help you with building these programs. Regional tribal health organizations, behavioral health. Well, thank you for all of those answers. And it looks like there's going to be quite a bit of data out there that we'll be able to access as we move through this program. Connie?
Okay, we're going to do a step-by-step description of this process so you can understand how to do this assessment. And like I said, we'll be guiding you through this process as your TA coordinators. But step one is really to identify your issue. And for Native Connections, the issue is suicide prevention. And so we're going to help you do that, and then find some insights into what the community's feeling and thinking about the issue, and any related issues like substance abuse and other things that might be happening as well. So that's the very first step, is to identify your issue. The second step is to really define your community. All Native communities are different. All communities are different. Some are in urban areas. Some span a large geographical area. We have different groups in our community. We have different things going on. Our communities are different types, like I said, urban, rural, reservation. And so we really want to define what that is. And we want to look at who out there should we really be talking to when we're defining our community. Would it be youth? Yes, probably, definitely for Native Connections, it would be youth. Elders are very important. And all other kinds of contacts that you know about in your community, they're important, that will help you define your community. And we'll explain that in more detail as the process goes along and we're helping you do this assessment. So step 3 is going to be determining your community's level of readiness, and we went through those stages. And I think Deborah always says this, and I really appreciate that she says this, is that this isn't a judgment on your community. This isn't anybody pointing fingers. This is just an honest assessment of where your community is, so you can start there and you don't start ahead of them. So conduct a community readiness assessment using those key respondent interviews. And then you just kind of follow the process. This is outlined in your Community Readiness Handbook that will be shared with you as well. For step 4, you're going to score that assessment. And for some, this is an overwhelming task until you actually do it a couple times, and then it doesn't seem so overwhelming, and it's very exciting to get the results. You're going to look at those 6 dimensions that Deborah talked about. Like leadership and resources available and knowledge of the issue and all of that. And you're going to come up with an overall score, but your dimension score is going to be as important as your overall score because it's going to tell you where to focus your effort. You're going to analyze using the numerical score, and you're also going to look at that content of what people say in the interviews. And what I've noticed is people in the communities that I've worked with are very excited about those comments. So it's really the first time they've really heard from their community. So I'll go ahead and turn it over to Deborah.
Okay, we wanted to look a little bit at scoring the interviews because this is going to be a really important part of making sure that your readiness level is going to be as accurate as we can get it. And when we do score the interviews, we're going to use 2 scores. And the scores that you decide to use, they should not be the ones that conducted the interviews. And this will be important so that this all plays into the bias part so that they just focus right on the scoring. And ideally, the scores, they shouldn't be scoring any friends or family. If there's people like that have taken the interview, that have done the interview part, then the scores might not be appropriate to score. And then there's going to be 30 questions that will be asked, and these will take maybe about anywhere from an hour, half hour to an hour to complete. And as Connie was saying, there is going to be a comment section in there. And when the interviewers do ask their questions, one of the things that we're going to work with them on is how to ask those questions so that they're asked as precise as possible from the interview sheets that we will be providing with you, so that when the interviewees do make comments, that those can be written down as accurately as possible, because that's going to help with the scoring. And then one of the things we always really stress too is the anonymity. We don't want names on the scoring sheets, and this is important to avoid any kind of bias. And this here is what the scoring sheet is going to look like. And again, there's going to be 2 people that will be scoring, so each one of them will have one of these scoring sheets that they'll be filling out. And there's going to be 30 questions, and then So each of the dimensions from A to F will have several questions in each one, and so that's what they're going to be filling out as they do their scoring. Once both of the individuals score their individual sheets and you get all of your numbers together, then both of the scores will get together, and that's where they will talk about each of the dimension scores. For example, in dimension A, question number 1, they'll each maybe have a different number in that score, and then they'll look at those questions, see if there's any comments, and together they'll come up with a combined score. And so each of the dimensions, again, are going to be scored. And then you're going to end up with an overall score. And again, that's going to be right. It'll be different for every community because we want that to be as specific as possible. And that's going to be where you're going to start. That's that is what's so important about that score. Sometimes we just need to know where to start something when we're going to make a change. But each dimension will also have a score, and those scores will be important when we move on to develop strategies. So we put this slide back up again because, again, this here slide is from a combined scoring. So the two scores have already did their individual scoring, and then they got together. And so you can see how, like dimension A, question 1, it's 6 points. Dimension B, question 1, 5 points. So over on the left side, you'll see the overall score by stage of readiness. So for example, dimension A is community efforts. This community scored 6.1. So their goal is going to be very specific, and that's going to be providing information to the community. So perhaps their activity or what they decide to do, their strategy, maybe it's going to be something along public relations. They're going to get more advertisements out in the community about the programs that are already in place or new ones that they're going to be developing. So you can see from each of the dimensions from A down to F, you're going to have the overall score readiness. So each one of those areas, the scores will be different. And this is where the coordinators will be working with you on understanding what these scores are and then helping you understand what those goals are so that the strategies or methods that you decide to do will be very specific to that score. And then in the lower right-hand corner, you can see a score there, 4.38. That's the overall stage of readiness that this particular community was in. So that told us exactly where they needed to start. Let's see. Okay, Connie?
Okay, great. Thank you. So now this is where you put all of that information to good use. We always wonder, what's all this assessment information used for? This is where we put it to really good use and really make our interventions and our strategies perfect for where our community is. So we're going to look at those scores, whether it be vague awareness or pre-planning or, no awareness. And we're going to develop specific strategies to help our community get more and more ready to address the issue of suicide prevention and suicide. These are going to be stage appropriate for each of the dimensions as well. So maybe the leadership is one of your lower scores, one of the lower dimension scores, and so you want to increase their knowledge in that area so that they can increase their awareness and be more involved in it. So for low levels of readiness, the intervention is going to be much more low-key and personal, one-on-one contacts, things like that are really going to make a difference to get people ready when they feel they can, address that issue. So step 6 is to evaluate the effectiveness of your efforts, really looking at are my efforts making a difference? Are more people involved? did more people show up at our honor walk, our memorial walk, or, suicide prevention walk? Are more people coming to meetings? Really looking at the effectiveness of what we've done. And we're also going to encourage to conduct a follow-up assessment. So you'll do the exact same process that we just went through, and more than likely the scores will go up because of what you've done. So it's really the meat and potatoes of the processes. That it's not just a one-time activity. It's a process that you'll keep doing, and you're really going to notice that progress that you're making. Like I said, the readiness increase for Step 7, begin to address closely related issues. There are issues that are related to suicide, and so we want to see what those are and look at how we can address those as well. We want to inform our leadership, and we want to apply to other related issues. So the next steps, we've kind of gone over the whole process with you just now, and so for Native Connections and your projects, the next steps you're going to take, and like I said, we're going to be there with you to support you in your efforts. Some of you are really good at this already, and some of you would need a little more support, and that's the way it's supposed to be. So we're going to have you identify 6 individuals to be interviewed. They're going to be a cross-section of your community, like education, health, behavioral health, law enforcement, social services, youth, elders, traditional people, those kind of things. And you're actually going to prepare your score. So that's the kind of an overview of the next steps, and I'm going to turn this over to Deborah.
Oops. Sorry. Okay, our next webinar, Native Connections, Defining the Community, will be January 7th in our new year, 2015. And again, all of our webinars are going to be on a Wednesday, and the time will always be from 2 p.m. to 3 p.m., and that's Eastern Time.
Okay, thank you, Deborah and Connie. We're going to open it up for questions. If you'd like to ask a question, you can press *6 on your phone to unmute, or you can enter the question in the chat box in the bottom right corner of your screen. And we'll just pause for a moment as questions come in. So again, *6 to unmute or enter in the chat box.
Okay, it looks like we have a number of people typing. Okay. Okay, we have a question. Can youth be interviewed for the assessment, and if so, how many? I think that will be something that you will that you can decide how to do that, how many you want to interview. And again, when you're doing the questionnaires, you only need to do between 6 and 8 people. And you can do, assessment specifically with the youth, or else with a more general population that Connie had just talked about. And it's another question, will we be developing our own readiness assessment questions, or will there be a template? Yes, we do have a template. We do have the questions for you. These are all ready to go. There will be 30 questions, and we are going to be sending out the Community Readiness Manual, and we're also going to be sending you all of the questions so that you'll be able to go through those and, get familiar with those. And we have a question, when are the assessments due? And I don't really think there's a due date on when they're due. It's going to be when you're ready to get the assessment started and go through the process of the interviewing and then scoring. And again, working with your coordinator to just look at what those scores are and how to work on developing each of the strategies. Rose asked, how much latitude are we given to develop our own? Because we are looking at suicide prevention with the community readiness model, all of these questions have been developed specifically for Native Connections and for the strategies that you're going to be developing. And so I guess the latitude, that could be if you're meaning like the people you interview or adjusting the questions. Again, it would be up to you which people that you do interview, but the questions are a template, and so we would recommend and work with you on following each of the questions and understanding what each of those are. Let's see. Do we have any more questions?
It looks like we do have some more coming in, so we'll just pause for another minute as everyone finishes typing.
Okay. These are really good questions to be asking because, again, this is such an important part of what we're doing. And, finding that place to start, with youth, with anybody in your community, is so important. Okay, we have a question. Can we do more than 8 interviews? 8 is the number that we would recommend that you do because you're looking to get a sense of the community. And again, the score is used for a starting place. And so if you do the assessment to different groups, because for example, in Alaska, with some of the bigger corporations, perhaps they might decide to do them with a number of villages. So they would be doing, the assessment with different villages to get an overall score for their area. Or for some of our nations that do have different tribes on their within their land base, maybe they're going to do the assessment with the different tribes in their area. But as far as doing one complete assessment, we would recommend that you do that with 6 to 8 people. Lisa asked the question, it seems that the more we do, the better picture will we have of our community region. That's a really good question because that's what it would seem like. But again, we have to understand what we're using the assessment for. And you're just going to be looking to get a general and overall sense of where your community is at. And you will be doing a post assessment. We do recommend that you do that, after you've had your programs in place for a while to see if that score is, if your scores are going up or going down, and that's where it's going to help you adjust. Okay, we had a question from Julia. Is Iceland Rio the primary contact for evaluation requirements? Iceland is with us here at Kaufman & Associates, and she's going to be sending out, I think you've all received the technology survey that was recently sent out, and she's going to be sending out the surveys like after various surveys and then, like after our webinars, but there also is another evaluation program that's going to be working with us. Wait, now let's see. Lisa says, we cover a very large area with several communities, so can we do 6 in each of those? Yes, you can. Again, that will help you get a better sense of where each of your communities is at. Candace? One could add a question or two to the CRA assessment tool, but the burden of the person who is being interviewed is important to consider. Your team and the evaluation advisors could talk about what you have in mind in adding a question or two. The set of questions have been used by many Native communities about a number of issues. When the interviewer is asking those questions, we do ask them to ask the questions precisely as they're written, but that will generate comments from the person being interviewed. And so those comments are the ones that you will be capturing through each of your interviews. Let's see, are there any other questions?
We still
Deborah, this is Iris.
Yes. Yes?
Was there someone else there?
Oh, Iris, this is Kim. I was just going to say we do have a few minutes left, so if anyone had any additional questions, to go ahead and enter those. But go ahead, Iris.
Yeah, I would just like to share with you some of my experience with this tool, and again, I really welcome the opportunity for all of you to be creative with this tool based on your resources that you have, and so we'll be creating a sample budget for you on the next webinar, so you see what the cost might be for you. That the different ideas that communities have had, we did 65 of these CRAs. We did a pre-CRA at the beginning of the project, and then over a period of every year, we would actually do a post-CRA at the end of a 12-month period to see where the change occurred for us. But some communities, because of the large land base that they have, you could have easily 80 miles between where your office is and another remote community on the reservation, or you could be working with, for example, in Native Connections, we're going to have several consortiums that are working with, sometimes up to 50 tribes across a region. So what I would have you keep in mind today is you have the opportunity to use this tool to the best of your ability that would meet the needs of your community. That might mean that you do 6 interviews that would be with youth, and because you're very interested in what the youth might score your community's readiness level. And then you could do other groups of people that you're very concerned about. For example, a community did single parent mothers in a particular age group, and they wanted to know, how did they see the readiness levels for substance abuse in their community. Other communities have taken a representation across the community, so they had someone from law enforcement. They decided that one of the interviews was going to be a tribal judge. And then they wanted to make sure that they had a school principal that was a part of the 6 to 8 people. And then they looked to however the community was organized around tribal health or Indian Health Service. They sometimes would interview a service provider, a CHR that was very knowledgeable of their community. And they would go across that spectrum. They would also interview very influential spiritual leaders, both in the church and traditional practitioners, because they have a very unique perspective of what the issues are in the community. They also, so the cross-cutting that you do in your selection, make sure that you are mindful that you don't want to leave out anyone, but you also know that as you begin to come together to do the scoring, if you do 15 interviews, that's still, in our practice, we're still going to end up with a similar score across those dimensions. The score that you've seen today, the sample score of 4.38, that's a pretty high score for tribal communities. I've seen communities that have scored a 1.2 as an overall score, and what they discovered is that their community was at the very lowest level of awareness, and there was a lot of denial that they were going to encounter. And what we discovered over time is that the reason this tool is so powerful is because you're looking at the readiness of the people and not the readiness of the professionals. So your readiness level is going to be probably a 6 or 7 or higher, because you're ready. you're ready to make change, but the community score may be much lower. And so that gap that you see over time is what we're trying to reduce in our planning and our use of resources so that the communities are able to really see that with the resources they have, they've aligned it with their readiness score, and they are able to see making really effective use. And other times, if communities received a large grant and they didn't do a readiness assessment, they did the best they could with their ideas on what they thought would work, and their interventions were at a much higher level, and they really didn't bring about any change at all in the community. So, I want to share that with you because I think that you have a wonderful opportunity. You could do multiple CRAs, and that's what we're here today is to help you. We can help you with the scoring. Our job is to help you to begin to create a strategic action plan based on this score. And our role is to be able to have the coordinators be as close to this process with you as possible so that the technical assistance that you need, you're able to do that through a phone call, through a webinar. We will have podcasts that will accompany these and just really help you each step of the way. I know that for many of you, you're all at different places. Some of you are ready to go do your interviews next week. You already have your people identified and will be ready to help you score. Others, it may take you a while to get going, but the longer it takes you to get the community readiness assessment completed, you're going to come into the next webinar series for the strategic action planning, and that score is what's going to help you to really be able to create that plan. So I just want to leave it as wide open as possible, and your coordinators are there to help guide you on how you do this. But, we've had communities that have done up to 3 or 4 CRA scores, and then they've been able to look at that across the community and see if that's what they'd like to work with. Thank you.
We have one more question from Vanessa. Let me read this. I do believe suicide is a big issue and concern. Her question is about the focus on suicide, not so much on substance abuse and mental health. She said, I believe substance abuse and mental health are also strong issues in our community with the youth. Are we not to focus also on substance abuse and mental illness, mental health? Iris, could you answer that question, please?
Yeah, I'll comment on it. The tool that you're going to be receiving, the 30 questions, we worked with the authors, Barbara Plested and Pam Jumper-Thurman, and this tool has to be customized to the issue. So even though you may not feel like you're going to be able to get to the substance abuse, this tool is specifically designed for the issue of suicide. And so as you plan out beyond this score and you decide, well, I think that it's important that maybe I focus on substance abuse, that's got to be a process that we go through to get you that tool, because you can't have 2 issues at the same time in this tool. The tool is designed for one issue, and all of the compounding issues that accompany suicide are going to emerge in that plan, in the comments that people bring forward. And depending upon the stage of readiness, you're going to begin to see how if the focus of the tool, for example, let's say the focus of the tool is on housing, and that's the 30 questions that you designed for that issue. That's the plan that you're looking to be able to develop. but I have to tell you, this tool that you're going to be receiving and our focus through SAMHSA has been specifically designed for suicide. We have done work on substance abuse, and that tool is a separate tool from the one that you're going to receive from us. And that's the direction that we received from SAMHSA, is that the tool, the focus of this tool is on suicide prevention. And, I really welcome your question today. It's something that we went around in circles on, and because, SAMHSA funds your grant and our technical assistance, this was their decision. This is the tool that they decided, and so that's how this was constructed with the authors. And, if you want to talk offline a little bit more about this, I'm open to doing that with you. But this is what we have today, and this is the guidance that we're receiving, from SAMHSA.
Okay, let's see. We have another question. We'll do this. We'll be the last one. I know that asking about suicide specifically is going to give us a good picture of our communities on this issue, but it seems that maybe we should pair a talk on resilience during our visits with people so that we don't end our talks on that note. Okay, let's see. Again, this will be... their coordinators will be working with the interviewers, and that's something that we can work with you on is how to end those interviews on a good note so that people don't, go away from those interviews discouraged, but, hopeful and looking forward to what's going to be happening. Thank you for all of those wonderful questions. That just kind of, I think, gives all of us a better picture, a bigger picture of just, how important this community readiness assessment is. I wanted to talk to you, just say a few things about the coordinators. That is myself, Deborah Bradler, Josephine Keefe, Connie O'Mara, and Gary Newman. Each one of us is going to be working with 5 different grantees, and by now you should have received an email or a phone call from us, just introducing ourselves and asking for a time when we could start setting up our phone calls with you. We've also sent out that survey, that technology survey, and I think we have a few more communities that haven't sent that back. And that technology survey is really important to us because we have, our grantees are in so many different places from, by urban areas all the way out to very, very rural areas. And so it's important for us to know what your technology is so that we can make sure that everybody, is able to receive what we're going to be presenting or how we're going to be working with you. So if you haven't gotten that technology survey in yet, please get that in. And again, I really thank you for being on our webinar today, and I look forward to the next one, which is going to be on January 7th. So I hope everybody has a really good holiday and a new year, and we will see you again next year. Thank you.